video we are going to learn about what are dental suture and why they are needed. So I am Dr. Alka. I am going to take you through a journey of learning of dental sutures. So let's dig into the journey of what exactly are the dental sutures and in which situations they are used, what are the different kind of materials which are available, and how you can use best in the oral cavity, and what are the different demonstration techniques. I have made certain separate videos for the demonstration techniques, but these are the few theoretical lessons that you should also know before going ahead to learn about the dental suture and actually practice them. So let's start learning little bit about the dental sutures. What are the different armamentariums, what are the different suture materials which are available in the market, and what kind of suture materials are to be used in which situations. This is I have prepared few presentations and I am going to explain them on my way. That also I am going to tell you a lot of my experiences with dental sutures. I am a maxillofacial surgeon. I am using sutures for the last 15 or 16 years and I have fairly used each and every suture material, and I can safely say that if you follow these guidelines there won't be any problem. You can easily do suturing in oral cavity without any difficulty. So let's jump on to this presentation. So what exactly is a suture? So a surgical suture is the one that approximates the adjacent cut surfaces. Okay, so these are the two adjacent cut surfaces and sutures are going to approximate these areas. Otherwise, without sutures, these areas will be far apart from each other. Okay, so if we are giving the suture, we are slightly bringing them closer. So that means the purpose of the suture is to approximate the tissue, and as well as whatever the blood vessels are bleeding from here, the purpose of the suture is to compress the blood vessels also. So it is basically a strand or a thread of the material which is used to approximate tissues and to ligate the blood vessels. That means in a nutshell I can see that it approximates the tissue, number one, and secondly it ligates the blood vessels. So these are the two methods, rather two indications for using a suture, and in oral cavity sometimes there is a lot of bleeding, so we give sutures to control the bleeding and we give sutures to close our incisions. So this is a basic definition of a suture. Let's jump on to what are the different suture materials, what are they, and exactly let's go on. So what exactly is the suturing? So we know suture, it is a thread material which is used for the approximation of the tissues. What exactly is suturing? Is the act, it is the act of bringing the tissues together and holding them back together in a position until, this is a very important line, until healing takes place. So that means whatever the act you are doing, whatever suturing procedure you are using, that is why different techniques are there, because whatever suturing you are using, it should be there until the healing takes place, because in certain areas the healing takes longer. For example, if you are suturing in oral cavity, the healing happens in 7 to 10 days. So you need sutures which last 7 to 10 days and then you can remove them. But if you are doing it on skin, so you need for 2 to 3 weeks. So you need to do the suturing accordingly. You need to choose the suturing material accordingly. So these are the different situations, and this is our motive of suturing, that it should bring the tissues perfectly together, plus it should bring the tissues into a position until healing happens. Okay, so let's go further. So what exactly are the requisites of an ideal suture material? Okay, so suppose I give you a suture material and I want you to stitch the oral cavity if there is a wound, and what I am looking for. I am looking for a material which should be strong enough so that whenever I am tying a knot, whenever I am passing it through the tissues, it should not break. So that means that is what is called the tensile strength. Okay, so sutures should not break when I am passing it through the tissues. and secondly, it should not be all the time untying. Means I tie the knots and patient comes to me and all the knots are untied within 1 or 2 days. Okay, but I want my suture to be there for at least 7 to 10 days. So I want a suture material which should not there will be no untying of the knots, plus there will be no knot slippage. If I'm using a suture material, suppose I am giving a knot, 1 knot, 2 knots here. So if one knot is slipping, the other knot, if I'm placing one knot and I'm placing another knot, there should not be any slipping of the knots. So that means it should be surgeon friendly suture, and it should be its tensile strength should be good, so that whenever I stretch it or pass it through the tissues, this should not break down, and there should be no untying of the suture material. And the second very important property of any suture material is tissue biocompatibility. What does it mean? That means they should be friendly with the tissues. Means they should not invoke any kind of foreign body reaction there. These days mostly synthetic sutures are being used. If you are using natural sutures, they evoke some kind of foreign body reaction. So if they are made up of organic materials, they do produce some kind of foreign body reaction, and we have to see what kind of suture material do we want to use in what situation. And tissue reaction also depends upon the amount. That means how many sutures are we placing. If we are placing around 6 to 7 suture or maybe 10 to 15 suture, and the size of the suture material, means whether we are using very small suture. Small suture means I will describe the zeros in the sutures in the upcoming slides. So if I'm using a very narrow thread, or if I'm using a very thick thread, so thicker the thread is, more is the tissue reaction. So I will see according to my requirement whether I want to go for the thicker thread or whether I want to go for the thinner thread. Accordingly, it will give the tissue reaction. Next comes the low capillarity. What does it mean? So you know what is the capillarity action. If this is the suture material, or if this is the wound, let me draw it. If this is the extraction socket and you are placing sutures here, you are placing lot of sutures here. Okay, so if these sutures are high in capillary actions, means they are soaking a lot of saliva, they are soaking a lot of fluids, so everything is getting transmitted to the tissues. Okay, so already around the wound there is lot of inflammation, already there is lot of, suppose it is infected. So in that situation, if the suture is also absorbing a lot of inflammatory liquid and everything, so that means they will act as a wick. You know what is a wick? So this is our burner, this is a wick, this is the oil. So these suture materials, they act as a wick. Rather, they absorb lot of liquids, lot of foreign materials, lot of unhygienic products, and they transmit those liquids into the oral cavity or into the wound itself and make it difficult to heal. Rather, it will increase the inflammation, it might increase the infection. So we have to be very careful while selecting a suture that it should have low capillarity action. So again, as I have told you, it should have ease of tying, facility, plus minimum knot slippage. Okay, so and it should be sterilizable, means we'll be able to sterilize the suture material, because we cannot put anything unsterile in the oral cavity or anywhere in the body. So in today's world, all the suture material that we get these days, they are already pre-sterile with ethylene oxide gas. So I would strongly suggest you go for the pre-sterile sutures which come in packing, which we will discuss in after a few slides. And finally, okay, so let's jump onto the suture material sizes. as long as the suture material sizes are concerned, so they come in a different sizes, and they come in different zeros. You must have seen there. So it comes from 5 to 12O. 5 to 12O. So number alone indicate the progressively larger sutures. Okay. So 5 number suture is very big, and 12O suture means it has big zeros. I'll show you in the next slide that. Okay, so whereas numbers followed by 0 indicates the progressively smaller. If we are looking at this number, if we are going into 6, 7, 8, 9, the suture size is very, very big, and we are going into zeros like 10, 20, 30, the suture sizes are smaller and smaller. So how they are? So 5 is more than 4 and so on. So then comes the 0, 20, 30, and then 30 is bigger, 40 is smaller, much smaller. Okay, so the number of zeros increase. So 10, 20, 30, 40. So the number of zeros increase, the size becomes smaller and smaller. The thread becomes thinner and thinner. So you have to remember this, the more the number of the zeros, the thread is thinner. So you need to choose that suture material which suits you the most and which suits the conditions most. Suppose if somebody is using for the plastic surgery, normally 50, 60 sutures are used. And if somebody is using for oral cavity, 30 and 40 sutures are mostly more than enough. We do not go for 10. For 10 sutures and 20 sutures are usually used for the ligation of the arteries. In the even in 20 situation, 20 can also be used in the skin situations. So mostly in oral cavity, you can remember that we can use 30 and 40. So what exactly are our aims and goals of suturing? So I have already told you that suturing is to approximate the tissues, and secondly to ligate the blood vessels. So what do we want to achieve with the act of suturing? So that means we want to provide adequate tension of wound closure. So suppose this is the wound. Okay, so I want to approximate this and with this without creating a lot of dead space. So what exactly is the dead space? Dead space is the empty space which lies between the surgical site. So if I am giving the incision here and I am doing my work, suppose I am doing my work here, I am giving the incision here. So whatever the empty area that I am generating is the dead space. So the purpose of the suturing is to close the wound without any tension. What is tension? That we are not stretching the tissues, we are not tensing the tissues. So without any tension, we want to close that space, and we want to eliminate the dead space also. This is our aim. Okay, and sometimes it is, sometimes it is not, but this is our aim, that we want to reduce the dead space as well as we want to close the tissues without any tension, without any pressure on the tissues. Okay, so and second goal is maintain hemostasis. That means, what is hemostasis? Control of bleeding. Suppose you are doing full mouth extractions. Okay, full mouth extractions, there will be a lot of bleeding, and I am washing, I am cleaning it, and then if I put lot of sutures there, right, so that will achieve my goal of hemostasis. So this is also my goal when I am doing the suturing. This is one indication that I want to do the suturing because I want to control the bleeding. So this is what is hemostasis. Okay, so what is primary intention healing? So primary intention healing is when this is the incision line, and when when the two parts of the incision line, this is one part of the incision line, this is the other part of the incision line, and this is the incision, and when two parts of the incision line, they get approximate beautifully with the help of the suture, and then becomes a thin line for the healing. This is called primary intention. Suppose if I leave my wound like this only, so whatever healing now I am getting is secondary healing. Means whatever healing is happening, there will be a lot of scarring. There will be delayed healing, there will be a lot of scarring. So if I can get any primary intention healing in any kind of wound, that will be preferable. Sometimes you do not get the primary intention healing. Suppose you're doing the extraction, and of course you cannot close these completely because there is a bony socket here. In that case, even if you give the sutures, you can bring the sutures still here without any tension, and here it will be primary intention plus secondary intention healing. It will be combined. Okay, so my aim is to do the suturing to motivate the primary intention healing as far as possible. Okay, so this is the goal of my suturing. Yes, to provide this support of the tissue margins until they have healed. So if I'm doing a flap surgery, so these are the flaps. Okay, so let me do it again here. These are the flaps. Okay, so these are the margins of the flap. So what happens when the healing starts? There will be new tissue formations around these flap margins. So what I want to approximate these flaps so that they have healed, and then only I will remove the sutures. They support my tissues. Okay, so they give a lot of support to my tissues, and once they no longer need the support, I can remove them. This kind of suture material, this kind of suturing I want to do. Okay, so and reduce, what is the aim of my suturing? Reduce post-operative pain. How is that possible with suturing is, see, if I am doing an extraction, if I have given a cut, incision, if I am leaving it like this without suturing, so what will happen? This wound will start healing with secondary intention. And if you read about secondary intention, you will see that there is lot of inflammation that happens during secondary inflammation. Lot of inflammation. And what is the cardinal sign of the inflammation? Pain. So more inflammation, more pain. Right? So we want lesser pain. So how can we achieve it? We can approximate these margins, and suppose if we can primarily close it, so that wound will be converted into a primary intention healing wound. And suppose if I cannot close it, at least I can slightly approximate it so that my post-operative pain is less. Secondly, post-operative pain is less because less foreign bodies are going to enter into this. Okay, so suppose if this is an extraction socket, I have given the sutures, I have given the figure of 8 sutures, right? I have given figure of 8 suture. So whatever patient is eating, it is not entering into my socket. Whatever is entering into my socket, it is basically a threat to my socket, and it is going to do a lot of problem for my socket. So I do not want anything to enter. So these figure of 8 suture will give a lot of protection to my extraction socket, and eventually it will lead to the decreased post-operative pain. Prevention of the bone exposure causing delayed healing and unnecessary desorption. Suppose if you are doing an extraction of a lower molar. So this is the extraction socket that you will get. So this is the furcal bone, lower molar. So if this is extremely big wound, so if I am giving here my figure of 8, so this furcal bone is protected. It is not exposed to the external trauma. It is not exposed to all the fluids of the oral cavity. It is not exposed to all the food particles, and it is protected. So once this healing happens, I can remove my sutures and my bone is protected. Suppose if I'm doing a upper 6 extraction. This is the maxillary antrum. Okay, if I'm doing the extraction, there will be only a periosteal covering here. So I want nothing to go inside the wound. So if I place sutures here, my internal lining would be protected and my bone will not be exposed, and there will be good healing. Yes, definitely proper flap position. That is the aim of the suturing. So next we can jump on to the classification of the suture material. So here I am going to stop the video because it is going to be very, very long. So I want to give these videos in a short format so that you can see it as per your convenience. So I am putting this classification into the next video.